Dr. Sogol Jahedi, did I pronounce that correctly? Great. She is a Chicago native and an obstetrician and gynecologist at Lutheran General Hospital. Aside from being a mother and to a young daughter and a wife and somebody who is part of a large family, she's also somebody who really believes in the value of teaching and working with people at various stages of their lives to help them essentially empower themselves. She's won many awards for her teaching and for her ability to mentor other people, and I'm very, very excited to hear from her. So without further ado, Dr. Sogol.
Good morning, everyone. I would ask you how you are, but I now know a little bit better about how to grade that. Thank you for having me. This is actually the first year that I'm speaking here at the Skinless Project, and I'm so honored to be here. I have the dubious distinction, I think, of being the kind of doctor women really drag their feet about going to see. Most people that end up in my office are like, oh God, I'm here again, for the PAP, and I hate it. And I'm like, yeah, I know, I hate it too. It's one of those things that we do as women. We go to see our healthcare providers. We certainly go, especially during our reproductive years for pregnancy-related reasons, et cetera. And so I thought today maybe the best way to kind of incorporate health or talk about health would be to kind of go over the annual exam, because it encompasses all age groups and it encompasses all aspects of health, not just what I do necessarily always as an OBGYN. So I have a presentation I'd just like to go through. I'm sure most of you have gone to your gyne or your internist or your family medicine doctor, whoever takes care of your health. And as women, obviously, we go for a variety of reasons. People always ask me, when should I start to bring my daughter to the doctor? When does she make the switch from a pediatrician to a gynecologist? And I always say, kind of when you feel that, she's asking questions related to, sexual activity, becoming a woman, et cetera, et cetera. It's very different for every person. I see people in my practice who are 12 and have really painful cycles. And then I see people who I actually just saw a very, very nice lady yesterday who was 82. Who was having some issues too. So it really just kind of runs this spectrum. So let me just get started. When was your last annual exam? I'd like you to just take a minute and think, when was the last time that you made time for yourself to go have your health addressed? It's recommended for every woman every year, and you don't have to go see a gyne. You can go see a family medicine doc or an internal medicine doc. Most people are worried sometimes about insurance coverage, and now thanks to a lot of changes in the healthcare law, these are visits that are covered 100% by all insurance companies. That's actually a federal mandate. There's no copays, there's no deductibles, and really the screening that you get at a very, very simple visit could bring up certain points that could save your life. Most of the time when it comes to establishing care with a patient, there's things that you want to go over, and I think a good physician will take the time to go over very, very basic aspects of your life. What kind of lifestyle do you lead? Are you active? Are you a little bit more sedentary? Are you, actually exercising, or are you running around after kids all day? What's your diet? And I always ask my patients, and that's something that people, I always joke around and I say, when it comes to things like asking about diet or, how much you smoke, people always say that they smoke less than they actually do and that they're taller than they actually are if you ever ask them their height. So certain things you kind of take with a grain of salt, but diet's very important. Exercise, really, really basic things. Do you examine your breasts every month? This is something that a lot of women have never been taught how to do. So I always go over, just the basics of how you are actually taking care of yourself in your day-to-day. Tobacco, alcohol use, obviously. Sexual health habits. I see sometimes teenagers that come into my practice more frequently than I think any mother wants to admit. I see a lot of young women who come into my practice who are from, have raised in very culturally, sensitive homes and are very religious families, et cetera, and these girls are sexually active. They're sexually active. And their parents don't know, and it becomes my responsibility then to make sure that they're safe, that they're protected, that they're X, Y, and Z, and still maintain that trust that they have, and it's kind of a tricky balance. So questions about sexual health is not something that's always discussed in the home, and something that I think should be discussed at a doctor's visit, and sometimes is the best place to be discussed is at a doctor's visit. And then obviously family history. Do you have a history of certain genetic illnesses in your family? Does everybody in your family have high cholesterol and heart disease? Or do you have multiple family members with breast cancer? There's certain trends that we can pick out from going through somebody's history that gives you a lot of information as to what their risk factors are. For the reproductive age group, people in general are divided into two categories. There's the group that wants contraception, and they come to me and they're like, you know what, I can't get pregnant, I won't get pregnant, I have to do anything, to make sure that I don't have pregnant. And obviously then we go over the options. There's so many options. Shots, patches, rings, pills, devices, all of all sorts, and that's a conversation that could take a talk in and of itself. And then the other group comes to me and says, I need to get pregnant, and I need to get pregnant now, and it's not happening, and why isn't it happening? And so for that particular group, we kind of go through optimizing your chances for pregnancy, dietary considerations, things like folic acid intake, watching your fish intake because of mercury levels, certain things that maybe are nuances that the average person wouldn't necessarily know or be concerned about. But we go over that in preconception visits, as well as how to optimize your chances, obviously. But I think the most important thing that we do as physicians is we actually do certain basic screening tests. And these are most of the time very, very simple tests that could ultimately, honestly, save your life. And I, go through heart health always first. And even as a gynecologist, it's not the first thing that you would think of. You would go to your gyne for heart health. Heart disease is the #1 killer of women. It kills more women than every type of cancer combined, okay? And heart disease in women is very, very atypically presented, and there's this big push in the medical literature now, listen to your heart, because women present with chest pain differently. They present with shortness of breath differently, and oftentimes when they go to emergency rooms or physicians' offices with chest complaints, they're taken a little bit less seriously because they don't have that typical complaint of, oh my God, I've got crushing left-sided chest pain that radiates to my back. So again, we take heart disease and heart health in women very seriously. For the younger people in the group, it's something as simple as getting your cholesterol screened. The recommendations are once every 5 years after the age of 20. And people don't realize that the screening starts that young, but it's because we're realizing more and more as time goes on, probably diet related because of the society that we live in, but people have high cholesterol. I routinely have 25-year-olds in my office where I have to sit down and have the cholesterol talk with them. And you would never know that your cholesterol is high because you think, oh, I'm 27, I'm young and healthy and I don't have any other issues, until you have it checked. The way to know if you've ever had a cholesterol checked is that it's a fasting blood test. And that's the kind of the ringer for most women. Oh, you can't have anything to eat or drink for 10 or 12 hours before you've had it checked. So if you haven't had a cholesterol checked, do your heart a favor and get your cholesterol checked. It's a very, very simple blood test, and it can kind of give you a little bit of insight into how much you need to worry. The other thing, and this is the only time I'm going to go over numbers in this whole talk, I promise. With cholesterol screening, it's really important to know the numbers that your doctor gives you, okay? It's probably the only time that the numbers really ever become important. And a lot of it just has to do with the fact that most people have no idea what components are involved in cholesterol. And there's obviously different kinds of cholesterol. I break it down into, essentially total cholesterol, which is the overall number, and you want that to be less than 200. But then there's two main components to cholesterol, which is LDL cholesterol and HDL cholesterol. And the mnemonic that I learned back in medical school that I still to this day, L stands for lethal, H stands for healthy, okay? So your healthy cholesterol is your HDL cholesterol, and you want that number to be over 60. So you want that healthy cholesterol to be high. The LDL, or the lethal cholesterol, you want to be essentially, if you can, below 100. Pap smears. This is my reason that people come to see me. This is comedian, actually, Kathy Griffin, and she feels very, very strongly, apparently, about pap smears, enough to the point where she had hers on national television. While I don't actually advocate that for any of my patients, I can tell you a little bit about paps and how they're important. And let me just spend a tiny bit of time on the history of paps. Cervical cancer is the #1 cause of death in women in undeveloped countries, and that's because there's no pap screening. So what causes cervical cancer? Cervical cancer is caused by HPV, which is human papillomavirus. Most people don't realize that there's a direct correlation between HPV and cervical cancer. If you have never been exposed to HPV, you will never have cervical cancer. How are you exposed to HPV? It's sexually transmitted. Are there signs of HPV infection? There are none. Completely symptomless. You could carry HPV for your entire life and not know that you have it. It's small enough that it passes through condoms, so condom use is not protective. This is mostly a wake-up call for women when I have this conversation with them. HPV is the reason you show up every year to have your pap smear. We're checking your cervical cells for HPV. So generally, screening starts at age 21, and that's American College of OB/GYN's kind of general stance. Now, I grew up in a very kind of a conservative Muslim household, and we didn't talk about pap smears, and we certainly didn't go for pap smears at 21 because you weren't sexually active at that time. And so generally in my practice, I tend to take a little bit more, I think, of a culturally sensitive view toward papping young women if they haven't been sexually active. I don't usually pap them, even though the guidelines say to start at 21, because it's all dependent on your exposure to HPV. That's really what it all boils down to. But yes, the official answer is pap start at 21, and then every year through age 30, it's recommended that you have one annually. At age 30, the new guidelines tell us, get the pap, and with the pap, run something called high-risk HPV testing. And essentially what that does is it tests for the higher risk subtypes of this virus. If you are high-risk HPV negative and you have a history of normal pap smears, you can actually space those paps out to every 3 years instead of annually, which I think is a big plus for people because nobody likes having a pap smear. I don't like having a pap smear. So if you can actually space it out to every 3 years, it's still, I think, a little less painful. And then I have people who come to my office who've been going their entire lives getting pap smears, and I have these lovely, lovely older ladies. They come and they're 85 and they're like, Doc, I'm here for my pap. And I'm like, you don't need one anymore. You're done. 65 and you're done with your pap, assuming you've had a lifetime of normal paps and no other high-risk issues. The other screening test that I order oftentimes is mammograms. And obviously we're in Breast Cancer Prevention Month, and there's this huge push on breast cancer. And the reason is, out of everybody sitting in this room, and this statistic I think is what's so frightening to all of us, and even, I think about it sometimes, it scares the pants off of me. There's a 1 in 8 chance. 1 in 8 of us are going to be affected by breast cancer at some point in our lives. I think that's huge. Always good to remember that, the remainder, the 7 out of 8 are all going to be fine. But that 1 out of 8 is still reason to be screened. Mammograms start at age 40 annually. There was this big controversy a few years back. The U.S. Preventative Services Task Force said, oh, we can space mammograms out to every 2 years instead of every year. And then there was a pushback from the American Cancer Society. And so essentially the long and short of it is, get a mammogram every year. It's one of those things that potentially could pick up very, very early changes that could save your life. If for some reason you have a family history of breast cancer, especially if it's a first-degree relative defined as a mother or a sister who has breast cancer, then that bumps down your screening age, actually, depending on the age that your relative was diagnosed. So again, something to keep in mind, and most doctors obviously are religious about ordering mammograms. It's covered by insurance 100%, so nothing that you ever really have to worry about paying too much for. Colonoscopies are another screening tool, and I have a very difficult time convincing my patients to get colonoscopies. It is like pulling teeth. And I can understand why people would be hesitant. Nobody wants to, do a bowel prep or have a camera up their colon. I mean, I can absolutely 100% appreciate that that's nobody's idea of a good time. But at the same time, you're not going to remember any of it. And it's covered. And it could save your life. I tell my patients, out of all the things in medicine, out of all the diseases that we treat and all the conditions that exist, there are 3 things that I can prevent, just 3. I can prevent cervical cancer from doing pap smears, I can prevent breast cancer from doing mammograms, and I can prevent colon cancer from doing colonoscopies. That's it. I can't prevent a brain tumor from happening to you, and I can't prevent pancreatitis from happening to you, and I can't prevent anything else other than those 3 things. So if you have the option to have those 3 things done, get those 3 things done. And you'll thank yourself, even though it's painful. Another good reason to visit your primary during just an annual exam is vaccinations. And most of us, are vaccinated in high school or college. And then after that, I see women who come in their 30s or 40s or 50s, and you ask them, when was your last, booster for X, Y, and Z? And they'll just say, oh, I don't know. Stop going for vaccines. Once you're done with college, you're pretty much done with vaccines. And I would encourage you to take a minute to ask your doc if that's not something that they bring up. There is a tremendous rise in whooping cough in this country. Whooping cough was almost eradicated about 20 years ago, and now we are seeing this rise that is really just so prevalent, and it's because people aren't getting boosters. So especially I would encourage you, especially if